Hello and welcome to our lung cancer overview image, which is part of our playlist on lung cancer. All of our lung cancer images take place in a prison, but why? It's because they were framed, like literally, on my wall. The images. Just kidding. The images take place in a prison because there are two broad types of lung cancer, small cell and non-small cell. We have a really clever mnemonic to help you remember these, a small cell and a non-small cell. We even put them in the shape of a lung. Nice, right? We'll go into more detail about each cancer type in subsequent images. Remember, this is just the overview. Now let's start this overview with a general fact. Lung cancer is the leading cause of cancer death. We've put some old bones in the back of the image to help you remember this. I guess some of these prisoners never make it out. Now let's talk about lung cancer risk factors. See the prison guard? You can think of him as the biggest risk factor for any of the prisoners. I mean, just try to escape with this guy in the job. First, notice that he's smoking a cigarette. Breaking news, smoking leads to lung cancer. Next, notice that he is looking at some family photos to pass the time. That's because a family history of lung cancer is also a risk factor. Now take a look at the big radar he's checking. Is this to help him track down escaped prisoners? I mean, probably. The word radar should help you remember the word radon. Radon is a radioactive gas that leads to, you guessed it, lung cancer. Finally, see the hole in the wall behind the guard? That looks like asbestos, which is the type of insulation used in old buildings. Asbestos is our final risk factor for lung cancer. What's that? It looks like the prisoners are starting a riot. See the prisoner waving his blanket outside the cell? It has a maze design on it, because this symbol represents mesothelioma. You can remember this as mesothelioma. See how the blanket traces the outline of our lung-shaped prison cell? It's almost as if it's covering the lung. This is because mesothelioma is a cancer of the mesothelium. Just like the mesothelium covers the lungs, our mesothelioma blanket is covering our lung-shaped prison cell. Since mesothelioma is a disease of the pleura, it is not considered small cell nor non-small cell lung cancer. It is its own type of lung cancer, and that's why we put it in the overview video. So what all is there to know about mesothelioma? Mesothelioma is usually caused by asbestos exposure, so we've put another crack in the wall next to our mesothelioma blanket. They really need to switch over to non-asbestos insulation. This prison is definitely going to get a lawsuit. Next, see the spider in the corner? This is our Psammoma spider, and its web looks a lot like a Psammoma body. Psammoma bodies are just round collections of calcium that are seen histologically, and you guessed it, they are seen in mesothelioma. Now let's take a look at our other cell. He is holding a pan near the top of his lung-shaped prison cell. One might even say that he's holding his pan near the apex. This pan represents Pancoast tumors. Pancoast tumors are not defined by a particular cell type, but rather by the tumor's location, that is, the pulmonary apex. As such, Pancoast tumors are their own tumor type and are also not considered small cell nor non-small cell. Since Pancoast tumors occur near the pulmonary apex, their signs and symptoms are caused by the tumor compressing the structures in this region. When the superior vena cava is obstructed, superior vena cava syndrome occurs. When the sympathetic trunk is compressed, Horner syndrome occurs. We didn't make symbols for these syndromes though, because you shouldn't really think about them in terms of a memory palace. If you know that Pancoast tumors occur near the lung apex, you should be able to remember these syndromes by thinking about the structures near the apex. In other words, the superior vena cava and the sympathetic trunk. Let anatomy be your memory palace for these two syndromes. But now I want to talk about a few things you do need a memory palace for. Metastases. Metastasis occurs when the cancer breaks free from the primary tumor. You can think of this as the cancer escaping. Man, how are we going to fit an escaping symbol into a prison image? See the escaping prisoner in the bottom right of the image? This prisoner represents the sites of metastasis for lung cancer. First, notice that he is using a piece of bone to tunnel out of his cell. That's because lung cancer metastasizes to bone. In fact, it may present as a pathologic fracture. That's why we've put a crack running down the middle of the bone. I guess this bone wasn't meant to withstand so much digging. Next, take a look at the cap the prisoner is wearing. It kind of looks like an adrenal gland. And just like the adrenal gland fits snugly atop the kidney, this adrenal cap sits snugly atop this prisoner's head. This adrenal cap should help you remember that lung cancer also metastasizes to the adrenal gland. Next, notice the poster above the escaping prisoner. It has a picture of a brain on it, encouraging the prisoners to read. And they say we don't fund our prison systems enough. This brain should help you remember that lung cancer often metastasizes to the brain. Ouch. Finally, notice the tray of food next to the escaping prisoner. It looks like liver is on the menu tonight, boys. This delicious prison food should help you remember the final site of lung cancer metastasis, the liver. Obviously, a big metastasis on the liver may cause jaundice and hepatomegaly, and as such, a metastasis might present with these signs and symptoms. Again though, not putting that in the palace, you should just reason through the jaundice and hepatomegaly as opposed to memorizing it cold. Quick recap, lung cancer metastasizes to bone, adrenal glands, brain, and liver. And that's it for our lung cancer image. Before we close though, I want to mention a few more things for completeness. Lung cancer often presents as cough, wheezing, hemoptysis, bronchial obstruction, and effusions. We didn't put these in the palace though, and that's because you really shouldn't be using a palace to remember facts like these. For instance, to remember hemoptysis, think about a big lung cancer destroying healthy lung tissue. The damage leads to blood in the airways, which become irritated and leads to coughing. Only use memory palaces when there is no rhyme or reason to the facts you want to remember. Not for the facts like these you can reason through. Additionally, lung cancer may present as superior vena cava syndrome, Horner syndrome, and hoarseness. We mentioned the first two syndromes, but I'll briefly mention that hoarseness is caused by recurrent laryngeal nerve compression. Finally, lung cancer can present as a coin lesion on chest x-ray or as a non-calcified nodule on CT. Again, it's much better to look at these actual images than to put them in a memory palace. And now that I'm done with my soapbox, we can conclude this lung cancer overview image. Now let's explore the rest of this prison. We'll look inside its various small and non-small cells, and before you know it, we'll have lung cancer down.